Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to the Hair Loss Show, episode 89. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen. Welcome.
And in today's episode, we're going to tackle a topic on hair transplant surgery, which is our wheelhouse. But we want to specifically focus on what is sometimes referred to as Giga sessions. So large cases with high numbers of grafts. And so I'm gonna preface this by talking about my experience with this, because, and I'm sure you've had the same thing. We've been part of forums or Facebook groups, and you see people that it's great, people taking active interest in their own health and researching and having experiences and sharing their experiences, but you commonly see young people losing their hair and then going, right, I have elected, or I've had it completely done. So you'd see the 20-something-year-old, 22, 23-year-old who's lost a significant amount of hair and has gone and has had 5,000 grafts to completely redesign their frontal hairline. And then sometimes they show pictures immediately post-operatively, and then they will show, depending if they're where they are on that journey, they will show pictures of how fantastic and dense it looks at sort of 6 and 12 months, and it's a great thing to see. But I'm always looking at that going, oh, there's a little bit in the back of my mind that I worry.
Okay.
What do you think?
I agree, and that's the worry in the back of our mind is about the long-term consequences versus the short-term benefit. So let's define a Giga session. There's lots of different words out there. There's mega sessions. Now, I suppose a mega session means you're doing 2,000 plus grafts. Maxi sessions, I think that's 3,000 plus grafts, right? But I think a Giga session is for the very brave who go into the 4,000-5,000 graft feature. Now, I have seen at conferences results from 6,000 grafts in a session, and I saw one, believe it or not, for a 10,000 graft in a session. But that's a unique individual with a hyperelastic scalp to be able to do it. And it doesn't really compute because if we go back to basics of what a hair transplant's trying to do is to produce the illusion of density. So the critical thing to remember about the transplant is we're not creating new hairs. Mm-hmm. People who say they can create new hairs, they're pulling your leg. It doesn't exist yet. So if we can't create new hairs, then we have an obligation to use what we have sensibly. Now it's a statement of the perfectly obvious that the balder our patient is, the less donor hair they have to move. Mm-hmm. All right. So then you have two options. You can go more dense into a smaller area or less dense into a larger area. But we're not dealing with a static situation.
Correct.
And just because somebody is on medication, they're using finasteride or Noxtal, dutasteride, or whatever they're using.
And some of these people are not on these medications.
Correct, because they don't want to do that anyway. But even if you're on it, it doesn't mean that you're protected for life from progression of your hair loss. So if you consider baldness to be progressive, you've got to expect that the bald area will get larger and the donor area will get potentially smaller. So if you wanted to maximize the number of grafts that you have on your life to use, in my opinion, you would, if you could, you would strip first in a younger patient, do strips, do 3,000, 3,500 in a strip, because most patients can give you that without excessively stressing their scalp. You can sometimes come back and do a second strip with a lesser number. But for most patients, it's hard to believe they need more than 5,000 or 6,000 grafts in their lifetime. So when I see these densely packed 25-year-old patients who've had 5,000, 6,000 grafts harvested, particularly by FUE, I cringe, because the whole concept of FUE is to spread out the donor area to get a nice even distribution of thinning of the donor area, which means inevitably they have to creep close to the balding margin. So I wonder when I see these guys, in their 25, what are they going to look like in 10 years' time?
Yes.
And the consequences of getting it wrong are profound because you have two major problems. Number one is that as the bald area expands downwards or laterally here, you could be coming into an area that you previously harvested.
Yes.
If you do that, firstly, your FUE scars are going to be exposed, and number two, your grafts are going to fail. And they may be in a visually important area. So I go back to my core question. We want visual density. This idea that people have to have 100% density in their transplanted areas doesn't wash, because you can pluck hairs out of an area for quite a number of those hairs will go out before any visible thinning. And when patients come to me and say, oh gee, I've only been balding for the last 6 or 12 months, and then I look at their hair, what they really mean is, I only noticed it in the last 6 or 12 months. Mm-hmm. It had been there for years before, but that degree of thinning they hadn't tweaked in their mind yet to make it thinning.
Correct. So it's not, well, I 100% agree, but I think there's two factors there, isn't it? I mean, two ways of viewing it. One is, I want maximal density. The other aspect is the 20-something-year-old has got a probably over-exaggerated or overinflated expectation of what their hairline should be. And creating a hairline, because a young 20-something-year-old recently remembers that their hairline was relatively flat and very little recession, is therefore aiming for that, and therefore chewing up or using a large number of grafts in that sort of area, when later on, if they were to lose more hair, the margins could fall to the side and then expose more areas and require further surgery.
And another problem aspect about this, for all of that, is that the cosmetic surgical tourism industry relies upon Giga sessions. The attraction of going to Turkey, the attraction of going to one of these clinics, is that it's a single operation, right? Not multiple operations. You can have as much density as you want, says the marketing, and it's a one shot. Now, think about the consequences of the one shot. If you only have 7,000 or 8,000 grafts available to you in your lifetime, and you use 5,000 of them at the age of 25, you don't have a lot left for whatever's coming down the pipeline.
Correct. You can't predict that, and you don't know.
And the younger the patient, the
less more likely they're going to need it,
and the less predictable it is. So you've got to kind of come to an understanding about whether the Giga session thing is about a marketing aspect, or whether it's about really achieving patients' long-term interests.
Because we've seen this as well. I know. And I've seen a term that I'd never heard before, which was unlimited grafting. So you pay a set fee for as many as you need to fill an area. Whatever the consequences of that decision 5, 10, 20 years down the track.
Or you could be transferring the baldness from here to here. If you over-harvest this area and make it see-through, all you've done is moved your baldness from the upper part of your scalp to the lower part of your scalp.
That's right. And I think we spend a lot of our time in consultations trying to temper people's expectations. And I think that's, for me, that is probably the most challenging part of that interaction, is because people sometimes come with that sort of preconceived notion that they need flatter hairlines, dense packed area, so that it looks the way it looked, in the recent past. And a lot of it is education in going, right, well, this is the potential pitfalls. We don't know, but the potential pitfalls in the future. So let's try and minimize the risk of that as much as possible.
This is probably going to surprise people when I say it, but mathematically, most times when people are operating, they're aiming to get about 50%, not much more than 50% of normal numerical density. All right, so if there was 100 hairs there to start with, we're aiming for 50 plus. But what that translates to visually is something close to normal.
Yes.
And so it's about using that precious resource wisely.
Yep.
And so I've never done a Giga session. No. I'm not tempted to do a Giga session. I accept that I'm at the conservative end of the sphere, but I also explain to doctors when I talk about this as much to patients that if you're a doctor that's been in the field for 5 years, you haven't seen what that patient looks like in 30 years' time. I have. plenty of patients. 30 years later, I can see what they look like.
And to that point, I get a commentary that I get a lot is that, listen, I just want the hair now. I'm not going to care about it in 10 years' time. So I just want that to be sorted now while I'm young and, you know, single and all that sort of stuff. And I guarantee that in 10 years' time, everyone still wants to keep their hair. And no one has ever gone,
they're going to be devastated if they're losing it. So we really do feel that caution is advisable here. You have a limited and declining number of donor hairs in your lifetime, typically. So use them wisely. And so Giga sessions, I can't think that there's too many circumstances where that makes sense.
Correct. I think you need to be mindful of that and think long term, not think in the now, and, you know, sort of, I think being conservative, whilst not very sexy, is probably the best strategy in the long term.
And interestingly, I would say from experience that patients who think they need more often are satisfied with less.
Yes.
And so they're surprised when they say, oh, you know, I thought I needed 4,000 and you've done 2,500, you've done 3,000, but now that I look at it, I think this looks great. So again, you know, more isn't necessarily better. We just have to find the right balance. I say to the patients, you may not be able to know exactly how much you need to be happy, and I may not know exactly how much you need to be happy, but you'll know it when you see it. And so the idea is that negotiation is about how do I achieve their goals without pillaging their donor area and leaving us with nowhere to go in future.
Good. Look, you and I could probably talk about this topic.
It's a constant source of angst
for a long period of time. So, but hopefully that's sort of given you an insight into our opinion on this. Again, you know, make your own decision, be educated, and you know, hopefully that will lead you down the right path. But thanks again for watching, and we'll see you on the next episode. Take care.
Thanks. Bye.